A very warm evening to all our listeners and participants of this today's webinar, which is organized by the Heartfulness Wellness team. So today's topic is Caring for Your Heart, World Heart Day 2020. So for today's webinar, we have Dr. Rahul Mehrotra with us. Just about our speaker for today, Dr. Rahul Mehrotra is a cardiologist. He's a professor and chief of clinical and non-invasive cardiology, Artemis Hospital, Gurugram. He holds an MD degree in medicine and DNB in cardiology. Published more than 100 articles in national and international journals and chapters in textbooks. Keenly interested in exploring the scientific basis of spirituality. Has been practicing heartfulness meditation for more than 2 decades and is a trainer. He's regularly invited to international and national forums as an expert on science and spirituality. Welcome you, sir, on this platform on this World Heart Day. So, shall we start towards
Yes.
the webinar? So, this is a common question as part of this World Heart Day that all of us will be having. What are the most common heart diseases, and why is it important to be aware of?
So thank you so much for the invite. And this common question has an answer, which I'd like to begin with telling you that the heart is a wonderful organ, not just because I am a cardiologist and not just because we meditate on the heart, but because of several distinct properties of the heart as an organ. It is like the first organ to form in the body. It does not stop working, continuously work incessantly day and night. Just give a thought about this wonderful organ and maintains a steady rhythm all through with very little control from outside the other organs. And it is the last organ to stop. We declare a person dead when the heart stops. So, this is an organ which is much more different than any other organ in the body. And I'd like to say that this is the key organ in the body if we were to say that. So, having said that, there are different types of heart diseases. It's an extremely resilient organ, great reserve, non-stop working capacity, but still it is prone to certain diseases. And there is a host of diseases which can affect the heart. We can be born with defects in the structure of the heart, like holes in the heart. We may get infections sometimes on different parts of the heart, commonly valves. It may be involved in injuries. There may be tumors, although they are very rare tumors in the heart. Drugs which we take can act as poisons for the heart and affect the heart. It can be affected by certain autoimmune diseases like rheumatoid arthritis, etc. But a very important part of the diseases is the lifestyle diseases right here at the bottom. Now, these are the diseases because of the faulty lifestyles which one indulges in, which gives rise to this form of heart disease, which is lifestyle related heart disease. So, these are different types of heart disease, and why we should know about heart disease and why we celebrate the World Heart Day. You may not have heard of any other organ day, but Heart Day. Because of this reason, it is the number one cause of death across the world today. So when this is the data from WHO 2012, and even updated data is similar. We classify the causes of death, we compile the causes of death in a given year. So non-communicable diseases are, as clear from the name, diseases which are not caused by infections or any other reasons, but they are non-communicable. And the other name is lifestyle diseases. So lifestyle diseases are the causes of death in 68% of the population across the world. And the leader is cardiovascular disease, which includes the heart and blood vessels. Next are cancers, lung disorders, and diabetes. Communicable diseases like infections, COVID, dengue, maternal death, neonatal death are still much less in number. And this is the greatest cause of death worldwide. So everybody should be aware of this because if this is so common, it is likely to affect one of us, one of our family members, one of our neighbors. So these are the common diseases we are likely to succumb to. We have a great advancement that has happened in the scientific community. Understanding of heart diseases has improved, cancers has improved, and we have very good inventions with a lot of new drugs which have come up. But in spite of that, the graph shows that the diseases increased and deaths due to cardiovascular diseases increased in the decade from 2000 to 2012. In spite of all the advancements that we are making in scientifically in terms of drugs, technologies, understanding the disease, we are still succumbing more and more to these diseases, the non communicable diseases. So, just to summarize why we should all be having this on our radar, it is the number one killer across the world. The latest data from WHO is from 2019. It says approximately 18 million deaths were caused, which is 32% of all deaths globally. One third of all people die just of cardiovascular disease, out of which heart attack and stroke cause 85%. So, not all cardiovascular diseases we are talking about. We will be talking about mainly heart attack and stroke, which are the major killers across the spectrum. Besides, it incurs considerable morbidity also. Even if you survive a heart attack or live with a heart disease, there is a considerable cost involved and morbidity in the sense that your quality of life is greatly hampered. You're not able to function properly. The sad part is that, in spite of all the efforts, the prevalence of heart disease is increasing. That is why these kind of awareness increasing days are celebrated, like World Heart Day, and activities like these webinars, talks, awareness campaigns are undertaken to increase the awareness amongst people about cardiovascular disease, because this is not a disease which can be tackled by government or government spending or invention of wonderful gadgets like smartwatches or invention of wonderful drugs or devices. It will have to be at the individual level. Just like we say in Heartfulness, peace begins individually, every individual. That's why we say similarly in heart disease that unless every individual is involved in healthy lifestyle behaviors, we are not going to impact the prevalence of heart disease. The other misconception we have is that these are the diseases of the Western countries, and low or poor countries like India or Africa, Southeast Asian countries are more affected by malnutrition, tuberculosis, malaria, which is also not true. Even in our country and low to middle income countries, also cardiovascular diseases are the major killers. So these are a global problem, more so in the underdeveloped and developing economies because of lack of education and knowledge about these diseases. And the bottom line, the silver lining is that most cardiovascular diseases can be prevented by addressing behavioral and environmental risk factors. So, this is what we should be hopeful about. This is what we should be motivated about. These are common, these are increasing, but we can prevent them. And that gives us hope, and that motivates us to have these kind of sessions to increase awareness so that prevention can be successful. So this is why I said all of us should be aware of cardiovascular disease.
That was very informative, like how Sarah's told that how this cardiovascular diseases, the prevalence is increasing irrespective of any actions that is taken, and definitely it is a modifiable as far as the environmental risks are concerned. So that gives some hope for further managing the condition. And you have given a lot of insight about the prevailing heart diseases. So can you just let us know what exactly mean by coronary artery disease, which is a very common terminology which is not understood properly.
Yes, so even I shared that amongst heart diseases, it is the cardiovascular diseases that are the leading causes. And so vascular term means the blood vessels of the heart. So let us take another look at this wonderful organ in the body. So just look at the bottom. On an average, our heart beats 100,000 times a day, and we don't even care for it. So this is how it works. Continuously, it
Find a
pumps.
muscle about the size of a closed fist. A normal adult heart usually beats about 60 to 100 times per minute. With each beat, your heart pushes blood throughout your body. This illustration shows a cross-sectional view of the inside of the heart.
So this is how the heart continuously pumps blood. And because of the heart's pumping, all the other organs are able to receive blood and function properly. If the heart stops even for just 2 seconds, it is very difficult to stand upright. We will faint, we will have giddiness, and even unconsciousness. So this organ has to keep pumping continuously, even while we are sleeping, working, doing anything. So to do this pumping action, the heart muscle requires continuous supply of energy, which is provided by two blood vessels, which are arranged in the form of a crown on the heart. So we call them coronary arteries, which means a corona or the crown. So these are two coronary arteries, the right-sided and the left-sided. So they have to be open, they have to be supplying blood continuously for the heart to pump. What happens because of several reasons, which we are going to understand later on, is that this kind of atherosclerotic material, the scientific term is atherosclerotic material, or we can use the term a butter or a cheese-like substance, gets deposited inside the artery, causing the narrowing of the lumen of the artery, and thus the blood supply in the distal parts gets hampered. And when that happens, this is what we say the person is suffering from coronary artery disease, the commonest form of heart disease that we have, and the one which causes heart attack. So if you have blockages, many scenarios can emerge. The blockages can be 10%, 40%, 50%. The heart has again such a wonderful reserve capacity. Nature has provided this organ that even with up to 40-50% narrowing of the lumen of the artery, there will be no symptoms. The person will be able to run vigorously, play sports, have no symptoms at all. But the artery is functioning with 50% blockage because of the reserve capacity. But if the progression occurs and the lumen becomes very narrowed, more than 70-80%, then a person may experience symptoms when he is trying to exert, climbing stairs, running, doing some exertional activity, because the heart is not able to receive extra blood when it is required because of narrowing, which is now more than 70%. This is what we call angina. And this is one of the symptoms of a blocked artery, which we understand that now this person needs to understand that there is blockage, which is more than 60-70% in the artery. However, the other serious manifestation can be that even this minor blockage, 40-50% or even lesser, can suddenly rupture and completely occlude the lumen, shutting off the blood supply in the distal part. And this is what we call a heart attack. So this can happen anytime to anybody who is having plaques, who has not been having any symptoms, but one fine day when this plaque ruptures, you have a heart attack. So this can be another manifestation of coronary artery disease. So coronary artery disease can have several manifestations. We've understood how it causes angina, how it causes heart attack, but other can be, we know it can be silent. The blockages may continue to occur progressively and we may not have any symptoms if we are very sedentary, if we don't exercise, don't move around, or it can cause progressive loss in the pumping capacity of the heart, which we call heart failure, or it can cause sudden unannounced death. Sudden death is a devastating complication of coronary artery disease. So it can manifest in any of these ways. So let us see how the most deadly concept of heart attack occurs with this animation. It's a very informative animation, self-explanatory. What I have just explained, you'll
Like
be
all
able to
muscles in
see.
your body, your heart needs oxygen to live and work. Special blood vessels on the surface of your heart
So
called
these are the coronary arteries
deliver oxygen to your heart
continuously carrying blood supply. These are the red blood cells. and this is the plaque.
A blood
So
clot.
suddenly this plaque has ruptured due to some reason,
Two little
and
oxygen
as a
leaks
result
in the heart
of which
muscle.
a
The muscle
blood
tissue
clot
dies.
forms inside
This is
the artery,
called a heart attack.
shutting off the blood
Damaged
supply.
heart muscle may
So there is no
potentially lead to
supply
other
going beyond this
conditions.
blockage, and this part of the muscle dies. This is what is heart attack. But sometimes this clogging of the artery can be so devastating that the heart itself shuts down, what we call cardiac arrest, and the person may not be revived. So that is what is sudden death. If you survive an attack, you reach a hospital and further treatment happens. But if you don't, then it causes sudden death. So this was about cardiovascular disease, the different manifestations, and the commonest manifestation of heart attack.
Yeah, so that whatever videos that you have shown, which is very simple and easily and self-explanatory, and you have beautifully explained how this is formed. And can you just let us know what are the main causes for this and how can we effectively prevent it?
So this is the logical next step, that once we know we are all carrying blockages to different extent, can we prevent them? So the answer, as I mentioned early on, is yes. It is a preventable disease. The low socioeconomic countries are still battling with it. The lack of education is one of the factors, but the educated communities have largely brought down the burden of heart disease because of increasing awareness amongst the people. So, as I mentioned, this is atherosclerotic cardiovascular disease, which is because of the deposition of the cheesy material in the artery. Now, why this deposition occurs and why this suddenly ruptures in a patient? So, this has been studied across the world. In all continents, there was a very big study undertaken in more than 52 countries of the world, including all ethnicities from China, India, Southeast Asia, to the North American continent, to the South American continent, just to understand whether we have something common in heart attacks happening across the globe. So, what these studies brought out was there are these 9 risk factors, we call them, which are responsible for occurrence of increased deposition of the arteries and high chances of rupture leading to heart attacks. So, these were further divided into 2 types. At the bottom are what we call the non-modifiable risk factors. The two are age and family history of early heart disease. So if you are advancing in age, crossing 40s, 50s, 60s, then the chances of deposition go on increasing because this is also a degenerative process by aging. So as we age, the deposition is likely to increase and we can do nothing about it. The other risk factor is if we have inherited certain genes from our family members. If our family has had a history of early heart attacks, early heart disease, then we are also prone. Again, we cannot change our family history. But fortunately for us, 7 out of the 9 risk factors are what we call modifiable risk factors. And these are all related to our lifestyle and behavior, what we do from morning to evening. So if you look at them, it is physical activity, stress, cigarette smoking or tobacco consumption in any form, diabetes, obesity or overweight, hypertension or high blood pressure, and abnormal cholesterol or dyslipidemia. So all these can easily be prevented. 7 out of 9 we can do a lot about. And these are the factors we emphasize upon to prevent. And this is how prevention is being talked about. This is the data from a wonderful study carried out in a Scandinavian country, Sweden. We studied 20,000 men over a period of 11 years continuously and looked at their lifestyle behaviors. And it was shown that the number of risk factors for heart disease you have, the greater the heart attack, but the lesser the number of these risk factors, the lesser the heart attack in these patients. For example, if you have a healthy diet, the risk is 16% lesser. If you have alcohol in lesser quantity, we say absolutely no alcohol for Indians, then it is further reduced. And if you have other risk factors also being prevented, like no smoking, you are physically active, you maintain a healthy body weight, then if you have these 5 risk factors under control with your good lifestyle, then 80% of the risk of heart attack is taken care of. You have reduced the risk by 80%. This was the powerful impact of just a preventive lifestyle. No drug required for these things, just a lifestyle modification resulting in 80% reduction in the risk of heart attack. So these are the risk factors we need to understand about. The lifestyle related risk factors I've just enumerated in the previous slide, the 7 risk factors, and take care of all of these as required. So this is the answer to your question, how to prevent and is prevention possible? I think it is quite obvious. It is quite possible. We have proven it also scientifically.
It's amazing to know that 80% can be prevented by modifying the lifestyle.
The
That is,
commonest cause of death is a preventable cause of death. It's a man-made disaster because of our unhealthy lifestyle. No virus, no bacteria, no malnutrition is to blame. It is only and only our lifestyle which is to blame.
is absolutely. Thank you for that insight, doctor. And so, what are the major among Indians? What are the major risk factors involved in this? You can know
So
as a doctor who is working in.
very pertinent question since most of us, I should not say, but some of us watching this are Indians. But India has the unfortunate distinction of being labeled as the heart disease capital of the world. And now we are also the diabetes capital of the world because of the reasons that not only do we have the high numbers of heart disease, one of the highest numbers of people living with heart attacks, heart disease, diabetes in our country, but also because we are more prone to heart disease because heart diseases occurs almost a decade earlier in Indians. And we see the arteries of the Indians, we have extensive disease when we see our blockages. The arteries are also very small in size, difficult to work upon. And somehow, even if we eat less, we tend to accumulate more. So, all these factors go in such a way that Indians are one of the most prone to heart disease in the world. And we have studied Indians living even abroad, having healthy lifestyle, but still they were at a higher risk. Somehow we are more prone. So we've always tried to blame. There is a tendency to blame in our country everything on God or government. I am doing everything right, but unfortunately, I am an Indian, so I get heart disease. I have nothing wrong. I have done nothing wrong. But why do I get heart disease more? So, again, we have studied this phenomena. There have been extensive studies done, and we have understood that we are no different than rest of the world population in the sense that same 7 risk factors which are modifiable are explaining heart attack in us. We do not have any unique risk factor. But the 2 common risk factors that we have more than other people across the globe are physical inactivity and an extremely faulty diet. So we don't exercise at all. We indulge in very little exercise. We are couch potatoes. Most of us like to sit around. And the more prosperous we become, the more uh, upwardly mobile we become, the more sedentary we tend to become because why should we work if we are prosperous? That is the kind of mindset we have. Physical work is looked down upon. Several reasons are there because of which physical activity is much less. The number 2 risk factor, more common in Indian as compared to the West, was faulty diet, unhealthy diet, less consumption of fruits and vegetables. So when I say unhealthy diet, I don't mean that we consume more cholesterol. I don't mean that we consume more non-vegetarian food. I don't mean that we have oils which are defective. It has been clearly shown that these are not the responsible factors. The key factor is less consumption of healthy diet, which is lots of greens, lots of leafy vegetables, nuts, legumes, which is the key component. So these are protective, like an antidote, but we consume this in less quantity and consume other foods in more quantity. And there are several reasons why people do this. Let me show you a slide. Exercise, for example, has clearly been shown to be very, very protective for heart disease. There is a clear exercise prescription which we share with our patient. For our viewers, I'd just like to say that This is the exercise prescription, and easy to remember formula is 3 and 4. At least 3 to 4 days in a week, we should exercise. Every day, it should be at least 30 to 40 minutes. And in 30 to 40 minutes, we should be covering 3 to 4 kilometers. So if we are walking like this at this speed, then it is a good exercise which has numerous benefits for the body, brings down blood pressure, brings down blood sugar, brings down cholesterol, and overall shown to reduce the risk of heart disease, heart attacks, and even death. Uh, I often say this, it's a free of cost medication. Why don't we take it? It's a free of cost remedy. And there are numerous other benefits also. Similarly, dietary modifications, we have clear guidelines, less of white substances. Easy to remember, be wary of whites. White salt, white is sugar, white is maida, white is atta or refined flours of all types, white breads. Beware of whites. So if you are beware of whites, have more and more greens in your food, then you don't have to cram up these calorie charts or understand. This is a food pyramid which is very easy to understand for most of us. What is at the bottom should be involved in our plates. Maximum amounts of green, leafy, colorful vegetables, legumes, nuts, beans, more and more of fruits, healthy whole grain cereals can be had, millets can be had, but there is no substitute for the amount of vegetables and fruits that are recommended. If you read the fine print, nuts and legumes at least 1 to 3 times a day, fruits 2 to 3 times a day, vegetables even greater quantity. It says in abundance, vegetables in abundance. Meat, poultry, milk products, they should all be in as less quantity as possible. So very easy to understand concept. This is a further easier concept which we try to promote. This is what our plate should look like. Very colorful, very green, red, orange, multiple colors, raw vegetables, salads. The more of these, the less of heart disease. And this is what should be least. These are the modern untouchables, we call them. Stay away from these. Don't touch them. Least of all, don't take them in excess quantities. Colas, candies, all C's are bad. Candies, colas, we should try to stay away from them. Chips, colas, candies, these are the C's we teach children to stay away from if we want to avoid empty calories, unhealthy diet from going in. Cookies are also one of the C's that we like to add because they are very rich in salt, saturated fats, and all these. So a common question comes about that we often think that it is a wrong kind of oil that I'm using, which is causing more heart disease. That is not a factor. I've talked about good factors. More of vegetables are required. Bad things, oil is not so bad, but we should just know the cooking oils that are supposed to be good are all of these. The cheapest oil, again, mustard oil is supposed to be very good and almost as good as olive oil. So need not to rush around buying olive oil, expensive olive oil, and doing our cooking in that. Mustard oil and any other oil in rotation are as good as other oils. But we should definitely be wary of using these oils. These are very, very harmful, contains very high amounts of trans fats and saturated fats like coconut oils, hydrogenated fats, which are still not banned in our country because of being used by poor people. These are very low cost oils. Margarine, butter, palm oil. We should absolutely avoid these bad oils. Smoking cessation supposed to be zero. There is no lower limit of safe smoking. Even passive smoking has a risk of heart attack. I recently had a patient, young patient who had a heart attack. The only risk factor we could find was his friends who was sitting around daily were heavy smokers. And the other risk factor which we came across was stress. Again, a very ignored risk factor, stress. We say I'm having a very good lifestyle. Why did I have a heart attack? So if I question the people, we come across that they have a very stressful life. We are not sleeping adequately. We are working in a very stressful atmosphere. We are walking on streets that are full of stress. So overall, this subclinical stress creates scenarios in such a way that it becomes a risk factor for heart attack. So that is why we don't take stress very lightly. Stress is a known risk factor along with other six which I have discussed because it has been proven scientifically to cause heart disease. And the remedies are quite simple. Again, scientifically proven: yoga, meditation, recreation, hobbies, going out, walking in the nature, having pastimes, and looking for behavior changes. So, all these risk factors are very easily and very eminently manageable. And the Indian risk factors are only two, which I've just mentioned. And I'll just show why Indians are getting more of heart attacks in spite of having all these. We don't need any exercise equipment for going out and walking. You can walk anywhere you are. You don't need anything to go to a big super mall or store to buy healthy vegetables and fruits. They are easily available, plenty. But why are we not exercising as Indians, and why we are having very high prevalence of inactivity in our country? My patients keep giving us reasons like rainy season, we can't go out, there are potholes everywhere, my clothes will get dirty, my shoes will get dirty, there is plenty of traffic, we don't have parks, fancy parks like we have in the West, I have knee problem, I cannot walk, there is a lot of pollution, I cannot go out because I am likely to die of pollution if not of heart disease. There is no one at home, I can't leave my home alone, and of course I can't leave my TV, my smartphones. While I'm walking, I cannot look at them, so I cannot catch up on my social media. So I spend less time walking. Reasons for not having a healthy diet, the list is very long. These are all from my patients. We are vegetarians, so we are already eating healthy diet. What is unhealthy if I'm a vegetarian? We are not eating raw salads, healthy vegetables. We are cooking our vegetables in very high temperature oils, which destroys the nutrient value. And most of our patients say, हम तो बहुत कम खाते हैं. We hardly eat anything. I eat very less. Our elders drank a lot of ghee. So in Haryana, where I come from, there is a trend of having a glass full of ghee, and they claim that our ancestors lived 80s and 90s years of age consuming this much amount of ghee. So why should I not consume ghee? But they had a different lifestyle. They walked a lot. They worked in the fields. They had a lot of physical activity to do. Organic food is expensive. I can't buy organic. Dinner is my main meal after I have a very good nice dinner with the family. It's my bed which I want to hit and not think of walking or anything else. It's in our culture. I have to eat certain food items because I think these are good. And our school canteens, our offices, they contain only what I have asked them not to eat, like samosas, chola baturas, paranthas. So we have these kind of a food challenge. Go out and grab a fruit versus go out and grab a samosa or anything fried. You are likely to come back with a fried item sooner than you will have to search around for a green item. This is our culture, but I hope things change soon enough. The other excuse which we Indians are very fond of doing is there is a very dangerous trend of denying everything allopathic, everything that is coming from science, because there is this trend that allopathy is bad, anything which is Ayurveda, homeopathy is good. Drugs have side effect, Ayurveda has no side effects. Like things like this, cost of drugs, WhatsApp University, false claims about dissolving blockages in the arteries and things like that. Eating certain leaves, eating certain barks of trees is likely to cure you of heart disease. Claims without any scientific backing and people falling for it is a very dangerous trend, denying the drugs which have been very, very scientifically studied. So these are some of the reasons why we Indians, knowing everything, still are succumbing to heart attacks more commonly than other parts of the world, other communities of the world.
Absolutely. And doctor has clearly told about the preventive factors, including in a very simple way, avoid the whites and C's, like including the chips and Coke, and the reasons also, like in his own personal experience, the reasons what the patients actually tell to avoid and a healthy lifestyle. So just another thing which is connecting to that, I think the doctor has lightly touched it. How does this stress and mental health contribute to this heart diseases?
Okay.
Long.
So along with the C's that we have in heartfulness, we also have C's in junk food, colas, candies, cookies, but Indian C is also there, which is chola bhatura. So try to avoid this as much as possible. And of course, we have our own Indian remedy for meditation, for stress management. Originated in India, we are the proud claimants of this, but again, studied very well in the West. And this is the cover of the Time magazine 15 years ago, more than 15 years ago. And a Hollywood actor, which is on the front page, very proudly proclaiming that she meditates. And the headline reads, Science of Meditation. So, this is a science now. The Western world and the scientific community has studied it in detail and told us that, in fact, when you meditate, there are active changes happening in the brain. Like this is again from a functional MRI study showing that just 20 minutes, this is before and this is after, just 20 minutes of meditation, the brainwave pattern become very coherent from a very chaotic brainwave pattern. Certain areas of the brain shut off while certain areas of brain become very active. All this translating into better quality of life in terms of better memory, better cognition, better sleep, better habits, less of anger, less of amygdala hijack. So all these have been scientifically proven by scientific experiments. And yes, all types of relaxations, yoga, pranayam, meditation are known to reduce the risk of heart disease. Sleep, which is one of the major risk factors now, hardly anybody is sleeping. Teenagers complain of lack of sleep. Elderly people are walking around 2 a.m. in the night, unable to fall asleep. Youngsters are busy with their smartphones, social media screens, unable to fall asleep quickly after shutting off the phone. And these are also contributing to stress. These are very simple, cheap, low cost remedies. Unfortunately, we are not able to claim these remedies and derive the benefit. Harmonious family and social support is a very big stress buster. We used to call that family is a shock absorber of stresses and strains in our life. The bigger the family, the greater the shock absorbent effect. The joint families were had a greater support. Nuclear families have much lesser support. And now we have nuclear families where both members are living in separate towns. So this is the kind of factors which are giving us stress. We are social beings, yes. So we need all these social supports also. And is it proven that meditation reduces heart disease? Yes. So I'll share this wonderful book which talks extensively about the heartfulness way of practices and how scientifically it has been shown to impact overall health and well-being. Besides, we also have proof that coming from the scientific community that if you indulge in regular yoga, yogic exercises, pranayam, including meditation, there are studies. For example, this is from a European journal. Very large number of studies looked at, 37 studies put together, showing that when you do these practices like yoga, pranayam, asanas, meditation, your cholesterol goes down, your body weight goes down, your blood sugar goes down, overall improvement. And this is a statement from American Heart Association coming in 2013 on blood pressure. This, after again looking at the evidence from large number of studies, very meticulously done studies, they say that there is a recommendation that yes, meditation is helpful in BP lowering and should be recommended to the patients. So this is one of our own studies from India that we did in collaboration with IIT Delhi. And I was a fortunate participant in this study. We looked at heartfulness practitioners for meditation and cleaning, which is a unique practice available in heartfulness. And we studied them during meditation of 30 minutes and during cleaning of 30 minutes by hooking them onto electrodes and monitoring their heart rhythm with a very fine computer programming. When we looked at their heart rate variability, which is a very fine parameter, there was an immediate change shown in the physiology. From a harmful, stressful physiology of sympathetic dominance, we immediately switched over to a relaxed, composed parasympathetic dominant type of tone in our body immediately on meditation as well as on cleaning. So clearly proving our scientific benefit of these practices. And this is a very big recommendation from American Heart Association again, which came in 2017. So what you have seen over this presentation, heart disease, coronary artery disease, blockages, the commonest uh, killer of the world. So American Heart Association, after going through all the evidence we have with meditation, has given a statement that if you involve meditation in your daily lifestyle, it will result in cardiovascular disease risk reduction. So yes, meditation lowers the risk of having heart disease by different mechanisms, by different pathways. Science is yet to understand every intricate detail of that, but this is what we have based on evidence, a scientific top scientific body giving this recommendation that yes, meditation does have a beneficial effect on reducing the risk of heart disease, cardiovascular heart disease. So this is the take home I think we should all have from this presentation.
Thank you so much, Dr. Rahul, for your brief and I would say rather brief, extensive presentation and how that meditation helps in improving the cardiac health, along with the scientific presentations and papers that you yourself published and with the various sources that you have given to us. So thank you so much. It was very helpful. I'm sure that all our participants and all the viewers who are seeing this right now would have benefited from this webinar. Thank you all of you for attending this webinar and thank you so much, Doctor.
Thank you
Take
so much,
care.
Doctor, for the kind word. Thank you.
Thank you.